sorry.
When I said I wanted to learn more about gout, what causes it and how to avoid it, a lot of people said, really?
Really? That is just one of the many issues dealing with keeping your feet healthy. And joining us now from Atlantic Foot and Ankle Specialist, we have Dr. Libby Putnam. Good morning.
Hi, thank you. Good morning.
How are you? I wanted to take a shot of our feet because I think this is why you have happy feet and this is why I don't have happy feet. You're wearing the Sensible shoe.
I'm wearing flats. Yes, I am.
Very attractive flat.
Yes.
And then I have on these silly things.
That's right.
Can you see it? Where is it? Oh, above the table? No, you can't get it. There it is. What is that?
This
That's
is
about
probably 3.5, 4 inches.
Sure.
4 inch here.
with
That's exactly what you should be wearing all day long, isn't
also
it?
with a platform. See, but that makes it better when it has a little bit of platform. You're not on your toes quite as much.
Sure.
I actually refer to these as dessert shoes.
Because
If you eat healthy all day long, you can splurge and have dessert at the end of the day. If you wear good shoes, supportive shoes, all day long, you can splash out and go out to dinner in dessert shoes. But
So
not all day long.
not all day, exactly. Gout seems to be something that not a lot of people do know about, but it's very painful if you have it.
It is. It can be excruciatingly painful. Most people say that just the weight of a bed sheet on their toe at night is too much. They have to sleep with their feet outside the covers if they're having a flare. But it's something that not a lot of people know about, amazingly, because it affects tens of hundreds of
Right.
the toe isn't the only joint that can be affected, but that's probably where most people.
Most common. Mm-hmm.
The
most common is the big toe joint, the one that you typically see. Some people call it the bunion joint.
Yeah. And maybe you think that you did something. You maybe injured yourself, or that it's from your shoes. A lot of people, it takes a while before they get that diagnosis.
Mm-hmm. Yeah, most definitely. A lot of people will also think, oh, well, I'll just let it go a few days.
Yeah.
Right.
It's actually much easier to sort of nip in the bud if as soon as it starts being painful, you go in and see somebody.
Right. Now, we asked this earlier, but what does cause it?
So it's a compound in your blood called uric acid. Some people have levels that are too high, essentially. When the levels are too high, the uric acid crystals deposit in joints. Can be very, very painful.
I know when I was a kid and my dad had a flare-up or two, I think that he was told, and this is what I remember, that it was rich foods that caused it.
Yes.
That's why kings used to have it.
Yes.
In the old days.
It's been called the rich man's disease.
That's it.
King Henry VIII was supposed to have had it. Yes, foods that are very rich, very heavy foods, things that you see a lot of around the holidays.
Right.
Red meats, alcohol, turkey, things like that.
And can you monitor it with diet as well? If you start eliminating those things, do the flares go away?
Diet can't be a complete treatment, but it can really help you control the symptoms and prevent future outbreaks. But there are several, if you're prone to it, there are several medications.
Do people come to you as a foot doctor for treatment of gout?
Most definitely. Usually it's sort of a team approach. I work with the primary care physician. They usually manage those long-term preventative medications. And then I would be involved in the acute flares when those 5 days that it's really very painful. A lot of stuff that I can do, and then inserts, things like that, long-term.
Oh, see, I didn't think about that. Once you are seen by your general physician and you're on medication, but that really, at that time in there when it is so painful and so hard to deal with, go to a foot doctor.
Yep.
Duh.
Yeah. Well, what are some of the other just general good things to be doing now, the start of the new year, taking care of your feet, being smarter?
Sure. So a lot of people, New Year's resolutions, a lot of people want to get fit, get healthy, lose weight, things like that. Shoe gear is really, really important. You don't want to just dig out the tennis shoes that you had from 5 years ago that are in the back of your closet and use those. You could end up, plantar fasciitis, all kinds of different sore muscles, things like that. You want to get something that's a good supportive shoe. There's no one brand that's going to work for everybody, but whatever fits your foot, whatever feels good, and whatever is going to give you a good amount of support.
Yeah, there's a reason running shoes are called running shoes, and tennis shoes are called tennis shoes, and hiking shoes are called.
Yes, exactly.
And I guess the best advice is, if you're having any problems, if you're having some pain, you need to have it analyzed and find out what exactly is causing it.
Yeah. A lot of people will come in and see me wearing flip-flops and say, oh, well, I came to see you wearing these because they were easy to pull on and off. And I say, well, no, I want to see what you're wearing on a day-to-day basis. That'll give me more of a clue of how to help you. So
All right.
bring in your running shoes.
Sure.
Well, speaking of runs, we have a 50-kilometer run coming up here, so these are some people who need to take care of their feet.
Most definitely. Most definitely.
Dr. Putnam, thank you so much.